Riluzole 50 mg oral film is used to treat a specific type of nerve disease called amyotrophic lateral sclerosis, ALS, also commonly called Lou Gehrig's disease. It helps to slow down the worsening of this disease and prolong survival. The recommended daily dosage for Riluzole 50 mg oral film is typically 1 tablet taken twice a day, at least 1 hour before or 2 hours after meals. It is important to take this medication at the same times each day. Before you start taking Riluzole, make sure to read the instructions for use from your pharmacist. Take this medication by mouth on an empty stomach, usually twice daily as directed by your doctor. Open the foil pouch with dry hands and place the medication on top of your tongue, letting it dissolve. Do not cut the film, chew, spit, talk, or drink any liquids while the medication is dissolving. Remember to take it at the same times each day to get the most benefit from it. Do not increase your dose or use this drug more often or for longer than prescribed. If your condition gets worse, be sure to tell your doctor. Some common side effects of Riluzole 50 mg oral film include dizziness, drowsiness, nausea, vomiting, or numbness/tingling around the mouth. If any of these effects persist or worsen, inform your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed because your doctor has determined that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. Contact your doctor immediately if you experience any serious side effects, such as a fast heartbeat, signs of liver disease, signs of infection, or signs of lung problems. A very serious allergic reaction to this drug is rare. However, seek medical assistance immediately if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects not mentioned here, contact your doctor or pharmacist. If you are in the US, you may call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. Before taking Riluzole 50 mg oral film, it's important to talk to your doctor or pharmacist if you have any allergies or if you have a history of liver disease. This medication may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. It's important to avoid driving or using machinery until you know how this medication affects you. Also, let your doctor know about all the medications and herbal products you are using before having surgery. If you are pregnant, talk to your doctor about the risks and benefits of using this medication. It's also important to consult your doctor before using this medication while breastfeeding. It's important to be aware of potential drug interactions when taking Riluzole 50 mg oral film. These interactions can affect how the medication works and may increase the risk of serious side effects. Remember to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact your local poison control center for assistance. In the US, you can reach the Poison Control Center at 1-800-222-1222, while Canadian residents can call their provincial poison control center. Symptoms of overdose may include mental or mood changes, severe drowsiness, confusion, and memory loss. It's important not to share your medication with others. Before starting this medication, you may need to undergo lab and/or medical tests, such as liver function tests, and continue to have regular checkups while taking it. Make sure to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next dose at the usual time. Don't take a double dose to make up for the missed one. When it comes to storing Riluzole 50 mg oral film, it's important to keep it at room temperature and away from light and moisture. Make sure to keep the medication in the pouch until you're ready to use it and avoid storing it in the bathroom. Keep all medications out of reach of children and pets. When it's time to dispose of the product, do not flush it down the toilet or pour it down the drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this responsibly. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.